Carotid artery? Yes, I did. And what did that entail? It entailed the platelet clots that cause TIAs. And, doctor, is that an important warning sign that a stroke may occur in the future? Yes, it is. 5 years on, at least 1 in 6 sufferers will have experienced a full-blown stroke. Doctor, when the clots are identified as coming from a clogged carotid artery, carotid endarterectomy or carotid angioplasty have the potential to solve the problem and prevent a stroke from occurring. Does research suggest that surgery to treat severe carotid stenosis can have the risk of experiencing a stroke over the next 5 to 8 years? That is absolutely correct. It is most effective, often carried out within 2 weeks of a TIA or stroke. And, doctor, if both carried out as 2 separate procedures, what happens then? That is a serious condition. Doctor, if performed under a general anesthetic, you will receive what? You will receive drugs via a drip to put you to sleep. And, doctor, if having the procedure under a local anesthetic, a numbing agent is injected into the skin of your neck, then more local anesthetic can be injected, is it not true? During the procedure, if you feel uncomfortable, you will be given a sedative too, as you are less likely to remember the operation afterward. Doctor, the anesthesiologist may insert a special drop into an artery in your wrist to allow careful monitoring. Is that not true? Well, if the monitoring is of your blood pressure during and after the operation. Doctor, this is because blood pressure is partly controlled by special sensors? Yes, called baroreceptors, some of which are found within the internal carotid arteries. And they monitor the pressure of blood, doctor, going to the brain? That is right. If carotid arteries monitor the pressure of blood pressure going to the brain, if this pressure reduces during surgery, the sensors may trigger changes which need to be controlled. Is that not a fact? The surgeon makes a cut that runs obliquely for 2.75 inches to 4 inches from the angle of your jaw toward your breastbone. This exposes the common carotid artery and its branches. And, doctor, the affected part of the carotid artery and its branches are clamped off? Yes, during the procedure, your brain will continue to receive blood from the carotid artery to the other side and from the vertebrae. Doctor, the internal carotid artery on the affected side does what? If you are having the operation under local anesthesia and sedation, the surgeon may make you from time to time or wake you and test your brain function by asking a simple question and asking you to move your hand. If your responses are slow, the surgeons may insert the shunt at that stage. And, doctor, the blood supply goes to the brain, does it? Yes, it does. The blood supply to the brain arrives through the arteries. 2 vertebral arteries enter the skull from the back and mainly supply the bloodstream.